We are all taught to trust doctors with our lives. They are the experts. They're supposed to save us, heal us, and give us exceptional care. But guess what? Sometimes things go horribly wrong. And that's exactly what happened to a 70-year-old man who put his life in the hands of his doctors, only for them to tragically fail him. The doctors were supposed to remove a diseased kidney, but they took out his only working kidney. Yeah, that's right. This is like when you go to a mechanic to get your tire fixed and they remove the inflated tire instead of the flat one. Unfortunately, the poor man died 5 weeks after the operation. So why did the doctors remove his only functional kidney? And were the doctors held accountable? Let's find out. This is the story of Graham Reeves, a 70-year-old Korean War veteran. For those who might not know, being a veteran of such a significant conflict means he served his country in one of the many tense and dangerous times during the Korean War in the early 1950s. This background made him a man who knew a thing or two about surviving tough situations. But as we will see, even the toughest can be vulnerable. Graham was getting old in years, and like many people his age, he had his share of health problems. His big issue was one of his kidneys was not working right. He was dealing with a diseased kidney. Now, a diseased kidney means that it's not functioning properly, which can lead to serious symptoms like swelling, fatigue, nausea, and even confusion due to the buildup of toxins and fluids in the body. Graham knew something was off because of these very symptoms, which eventually led him to seek medical help. Once the problem was identified, the course of action was clear. Surgery was needed to remove the diseased kidney. Normally, before such a surgery, doctors perform a thorough examination, including x-rays to understand the exact condition of the kidneys. These x-rays are important. They are like the roadmap for surgeons before they get inside the complex human anatomy. The main doctors in Graham's case were Dr. Mahesh Goel and Mr. John Roberts. Dr. Goel was pretty young at that time. He was about 39, and he was the one who was going to do the surgery. Mr. Roberts, who was almost 60, was there to keep an eye on things, supervise Dr. Goel, and make sure it all went smoothly. He had a lot of experience, so he was like the backup. The surgery happened at Prince Philip Hospital in South Wales. It was January 2000, a new millennium. But what happened next was far from a hopeful start. In the surgery room, whether it's a simple procedure or a complex one, a whole team gathers to observe and operate. Besides the main surgeon who does the cutting, there are others like nurses, someone to handle the anesthesia, and sometimes medical students who are there to learn. Once everyone was in the operation theater, the procedure was started. Now, let's take a closer look at what normally happens in the surgery room during a kidney removal. Typically, kidney removal, also known as nephrectomy, involves several steps. Firstly, the patient is put under anesthesia, ensuring they are asleep and pain-free throughout the procedure. The surgeons then make a few small cuts. In some cases, it is just one large cut. Through these, they have access to the kidneys. Remember, kidneys are present on opposite sides, so if one side is being operated on, the surgeons cannot access the other one. Now, once the kidney is exposed, the surgeon separates the kidney from its blood supply and the ureter, using special tools. The ureter is the tube connecting the kidney to the bladder. This is then attached to a new kidney if a new one is being attached, but this was not the case with Graham. Now, the part where the kidney is removed needs to be super precise, like defusing a bomb. Any slip can cause major issues like severe bleeding or damage to other organs. Once the kidney is free, it is carefully removed through one of the openings. The area is then checked for any bleeding or other immediate problems before sewing the patient back up. This whole process can take a couple of hours and requires a very steady hand and sharp eyes. All the steps were the same during Graham's surgery. The surgery was going smoothly. There were no evident complications. In that operation there was also a medical student named Miss Fern. During the surgery, she noticed something really wrong. The x-rays were up on the wall showing which kidney was diseased, and she saw that the doctors were about to take out the wrong one. She spoke and told Dr. Goel about this, but he didn't listen. He thought she was wrong and went ahead with the plan. And that right there was the biggest mistake the doctors made. Turns out, Miss Fern was right, and the doctors removed the only functioning kidney. Graham needed one good kidney at least, and they removed it. This kind of mistake is something you never want to happen. So what happened next? After the surgery, Graham was stitched up and sent to recovery. Everyone was relieved that it went well, but just 2 hours later, things started looking pretty bad. Graham was in the intensive therapy unit, and he was not producing any urine. Now, we all know we have to excrete urine to get rid of the toxic waste our body does not need. Well, Graham could not, and that was a huge red flag. Now, why was it happening? Why wasn't there any urine output? You see, kidneys are like your body's natural filter system. They clean your blood, keep the fluids balanced, and get rid of waste through urine. No urine means the filters are not working, which was exactly the case for Graham. The doctors had accidentally removed his only working kidney, leaving him with the sick one that was not doing its job. It was after 2 whole hours that the doctors had just realized they messed up big time. They probably felt like someone had knocked the wind out of them. They had to tell Graham and figure out what to do next, and fast. So, what were the options? Not a lot, to be honest. The doctors told Graham about the blunder, and he had to agree to another surgery the same day. The surgery was not going to be a simple one. It was a serious, life-threatening scramble to fix a massive mistake. This next surgery was a Hail Mary. They tried to put a tube into the bad kidney to see if they could get it to work even a little bit. But let's be real, they were trying to pump life into something that was already down and out. The chances of this working were slim, but Graham didn't really have much choice, did he? Going back under the knife so soon after the first surgery is rough on the body. Graham had to deal with another round of anesthesia, which is tough even on a good day. His body did not take it well, and things just got worse. Because of his worsening condition, Graham had to be moved to a bigger hospital in Swansea. Now, on top of everything else, he started showing signs of blood poisoning. This is as bad as it sounds. His body was fighting a severe infection because of the tube they put in the failing kidney. This kind of infection can spread fast and is deadly serious. Eventually, the situation was so bad that the doctors had no choice but to remove the remaining diseased kidney. This was literally the last thing they wanted to do, and it should have been a controlled decision during the first surgery, not a desperate move in a crisis. Graham's body was overwhelmed. He struggled for 5 more weeks, but his health kept going downhill. It is heartbreaking, really. He passed away from a heart attack and respiratory failure. You must be thinking, Graham had a non-functioning kidney, so how did he die of a heart attack and respiratory failure? You see, the kidneys in your heart and lungs are more connected than you might think. The kidneys help manage blood pressure by controlling the amount of fluid that circulates in your body. They also play a critical role in keeping your blood chemically balanced. When your kidneys stop working right, fluid can build up in your body. This extra fluid puts a strain on your heart and forces it to work harder to pump blood through your body, which can lead to heart failure. In Graham's case, when his functioning kidney was mistakenly removed, his body was suddenly unable to manage fluid levels and blood chemistry. The remaining diseased kidney just could not handle the load. This meant his heart was under constant stress, trying to pump against higher pressure caused by the fluid overload. Now, on the respiratory failure, this complication often ties back to the fluid overload problem. When the kidneys fail, fluid can back up into the lungs. This makes it tough to breathe and reduces the oxygen that gets into your bloodstream. Without enough oxygen, all your organs start to struggle, especially your heart and brain. After his second surgery, where the doctors attempted to revive the non-functioning kidney, Graham's body was overwhelmed. The double dose of anesthesia, combined with his weakened state and the blood poisoning from the infection, likely exacerbated the fluid buildup in his lungs. All these factors led to his death. Now, let's talk about the fallout. The two main doctors, Mr. Roberts and Dr. Goel, were taken to court for manslaughter because their mistake was not just a minor error, it was a huge, life-ending error. The prosecutor hammered it in that what they did was so far below what is expected from skilled surgeons that it was criminal. They called it gross negligence. Imagine being so careless that it's considered a crime. That's how big of a mess this was. The trial revealed that there was a mix-up with the paperwork from the start. The hospital slip had the wrong kidney listed for removal, and this mistake carried all the way into the operating room. The sad thing is that the correct info was right there in the case notes and consent forms, but the surgeons had not bothered to double check. Whether the doctors were punished or not, an innocent man lost his life. How do you think hospitals can prevent anything similar from happening again? Share your opinions with us in the comments below. Before you go, make sure to like, share, and subscribe for more shocking stories. We will see you in the next video. Goodbye.